Hi, welcome to my channel PKR Vibes Career and Growth. Today we are discussing about global inclusive denial in a medical billing. First, we have to know what you mean by global period. So, I will give one example. If a patient went to hospital on an emergency way, and if surgery was done by the doctor to the patient, then there is a follow-up visit regarding that particular surgery. That is known as a global period. So, depending upon the severity of that surgery, there is a follow-up visit up to, for example, if the severity is minor, there is a follow-up visit up to 10 to 15 days. It is known as a minor surgery. If the severity of the surgery is more, there is a follow-up visit up to 3 months or more than 3 months. It is known as a major surgery. So as a AR caller, what follow-up you will take on a denial, I will explain. So as a air caller, you should have a proper analysis on a claim, whether the same services paid for the same doctor during the global period or not, and you have to check on previous date of services whether already got the payments in a global period or not. So if you are good at coding and if you confirm that the denied CPT is not related or not global inclusive to other paid CPT, then do modifications accordingly and resubmit the corrected claim with resubmission code 7. If you are not good at coding analysis, then task to coding assistance for corrections on the claim. Here I given an example, the date of service January 1st of 2022 with the two line items. The first line is 23650, it is a surgery code, it was paid. The line 2 is 9928457 modified paid, it was also paid on that particular date. So there I given again one more date of service, January 13 2022 is the date of service with the line 99285. This is also emergency code, ENM code, and there is no appended modifier, and we submitted that claim within the 15 days global period. Then insurance deny the second date of service, January 13 2022 with the reason global inclusive. So insurance, as for insurance, we got the analysis, we have to do the analysis and claim that. So if you are working on a date of service of January 13 2022, you should have to pre-call analysis on previous date of services, whether we have any global period inclusive payments to this doctor or not. So if you are doing analysis, then you find that okay, there is a surgery DOS is billed on January 1st of 2022 within the global period of 15 days. Then if you are a good at coding, then you can append a modifier 24 stating that it is not related to the global inclusive paid CPT. So the modifier explains that unrelated, modifier 24 explains that unrelated ENM code performed during the global period by the same doctor. It means that we want payments for 99285 CPT because it is not inclusive to the paid CPT on January 1st of 2022. So if you are not good at coding, then task to coding team. The coding team do analysis and they will append the modifier. So then after a modifier appended, after corrections on a claim, we have to submit the claim, corrected claim to the insurance with resubmission code 7. So the insurance, if after submitting the resubmission code, the insurance will take this claim as a corrected claim and there is a chance to get the payments. If after resubmission claim also, if you are not getting the payment, then do a proper review and appeal the claim with complete medical records. If for example insurance is approves your appeal, for example, if appeal is approved by insurance, your doctor will get the payments. That is nothing but you did the good job. So if appeal is upheld by the insurance, upheld means it is a denied. So if your whatever you appeal upheld by the insurance, then your doctor should have to do the write off with the reason of global inclusive. If upheld means they will give the reason why they will uphold the denial also. So this is a global inclusive denial, and we have to note one point: the inclusive and global inclusive denials will maximum occur while you submitting the ENM codes. So because there is ENM means it is a face-to-face conversation between the patient and the doctor. So after conversation they will take surgery, after conversation they will take the treatment. So the ENM codes, there is a chance to get the inclusive denials or global inclusive denials. If claim is denied inclusive, then you can append the modifier 25 stating that it is on same date of service by the same doctor. So that's why you appended the modifier 25 in inclusive denial. But apart from inclusive, if you are coming to the global inclusive denial, it is global inclusive means it is inclusive within the period of time, a certain period of time, up to 15 days, up to 90 days. So at that time you should have to append the modifier 24. It is stating that this it is an unrelated ENM code done during the global period. So this is a global inclusive denial. So thank you so much for your watching, and have a great health. Thank you.